Thank you so much. And first of all, hello and welcome to this fourth and final webinar in our African Civic Tech Innovators Meet webinar series, which aims to build a repository of civic tech case studies from across the African continent. My name is Halfdan, and I will be hosting this webinar. The topic for today is civic tech in low-tech environments, and my guest is Walter Kumbi, who is the founder and executive director of Source Code. And Source Code is a Mozambican tech startup active, I think, mainly in the health sector, but Walter, we'll come back to that later on. Well, first of all, welcome to you, Walter, and thanks for making yourself available. How are you? How are things?
Thank you very much. Pleasure is all mine. Thank you very much for extending the invite, and it's great to be here. Everything on our side is going as well as can be, given the situation.
I wanted to ask you a little bit about that, because I think in South Africa we hear a lot about the COVID-19 situation outside of the continent, but we don't hear much about what's happening in our neighboring countries. How are things in Mozambique at the moment with COVID-19?
Well, it seems like things are stabilizing more or less. At the beginning, we had a lot of state of emergencies where there was serious restrictions on. Things started getting relaxed, I'll say approximately 2 to 3 months ago. So the numbers in terms of cases increased since then, but they've more or less stabilized at approximately, I'll say, around 200 per day in terms of new cases. But also in terms of recoveries, we're at similar numbers, right? Like 150, something like that per day. These are ballpark figures. We've had to open the economy, obviously, but it seems like we've managed to control things more or less. And we never reached those really high numbers of thousands of new cases per day. So I guess we should be grateful for that.
Yeah. Has the development followed more or less the trend in South Africa, where we had a spike back in July, I think, and since then the number of cases have been fairly constant? Is it the same scenario you've seen in Mozambique?
I think our spike was a little bit later. The thing is, the cases in South Africa started earlier than in Mozambique, and the numbers started to increase much faster than Mozambique, which is why even the state of emergency, the lockdown in South Africa started before we even declared our state of emergency in Mozambique. So I would say we're a little bit behind almost in terms of when the spike was reached. But yeah, like I said, the thing is, it seems like the numbers are not going up anymore. It seems like it's somewhat stabilized. Time will tell, because like we know, in other continents, there's a second wave. Thankfully, we have not yet reached that stage. So yeah, fingers crossed.
We all keep our fingers crossed, definitely. So the topic of our discussion today is civic tech in low-tech environments, and we'll be looking specifically at Pensa. And Pensa is an mHealth platform providing health information in Mozambique through SMS and USSD. Since it's launched, and you will have to correct the numbers here, but I believe since it's launched in November 2017, Pensa has continued to grow and now has around 2.5 million users, which is really impressive. We obviously want to hear more about Pensa, but perhaps you can start by telling us a little bit about yourself and your own journey. What's your background, and how did you end up working in civic tech and specifically in public health?
It's a long story. I'll try and keep it short.
We have time.
But yes, now I'm a Mozambican. I had the fortune of getting different experiences abroad. So I did my boarding school in the UK, then I did university in the US. Upon returning, the first job that I encountered was at an institution called Untitled, and they were essentially spearheading the e-government movement. So, for instance, I did things like manage the government portal with other colleagues, obviously, and teach senior level officials on the use of different technologies throughout the country. So following that, then I worked at what's now called TMCell, back then which was called MCell. It was at the time the largest mobile network operator. And for me, I keep on saying that till today, it's been my greatest school, essentially. I learned so much in my time there in terms of technology, in terms of reaching the masses, in terms of impact, and even in terms of how to develop a new product. And after the almost 10 years I was there, I branched out and started doing consultancy and entrepreneurship. Then just started seeking different projects that eventually led me to Pensa.
Already we're getting into discussion, and I have so many more questions I want to ask you, but But before we get too deep into it, I really want to first of all thank and recognize the Konrad Adenauer Foundation, who is funding this webinar series. Since the early 1990s, Konrad Adenauer Foundation has supported the South African democratic transformation process through education, training, and research. And CAS is a recent partner of the Civic Tech Innovation Network. And we are really grateful for their support, without which this webinar really couldn't take place. So I want to thank you. And I believe there are some people from the Konrad Adenauer Foundation. So thank you for the support. Walter, coming back to you, before we start talking specifically about the health sector and some of the challenges that the Mozambican health sector is facing, I think we need a little bit of context here. Again, the premise of this discussion is civic tech and low tech environments, but perhaps you could start by, well, I guess another question would be, is it fair to characterize Mozambique as a low tech environment?
Unfortunately, I think so. Mozambique is a very what's the right word? Sprawling country. At times, it's with a large number of the population living in rural areas. So it's not easy to get the entire country connected. It's a serious effort. So if we venture a little bit outside of provincial capitals, outside of the capital of Mozambique, we start seeing that tech still has a way to go to reach there in terms of data networks and so on. So I think that that's a fair assessment. Yeah.
Do you know anything about the internet and mobile penetration?
That's one of the things that makes this difficult, is the contradictory information that's been made available regarding that. In essence, I think the census says something around 7% of internet penetration, but in other reports, I get around 17%. In terms of mobile phones, the census says something around 7 million Mozambicans have mobile phones, whereas again, in other reports, they say 50%. So it's a subject of debate, let me put it like that. But either way, it's not impressive numbers. If you look at either of those numbers, we're talking about mobile penetration, either 25 or 50%. It's not really that much. And more internet penetration, much, much less as well, 7 or 17%. So yeah, we still have a way to go in that regard.
Perhaps, I mean, I know from other countries, there's also a difference between mobile ownership and having access to a mobile, that some families share mobile phones. Is that the case also in Mozambique?
Definitely. In many situations, a single phone is used by several people in the family, so you're not even sure exactly who you're reaching. And it's a consideration that must be taken into a lot of systems that are built. Again, without divulging too much, but for instance, if you're working on a system of notification of medical results, you have to take in consideration that the number that is used to access might not be the person who actually is expecting the results. All of a sudden, you have to be extra cautious as to how you do things.
And what do you know about the level of tech literacy? I mean, I know it's a big question, but what's the level of tech literacy? Are people comfortable with technology? And I guess it varies also across demographic groups, but
Exactly.
Let's say the young population.
Exactly. It varies greatly amongst the demographics. For instance, my first job, a big component of it was encouraging tech literacy. I used to work at what was called the CPD, Centros Provinciais de Digital, something along those lines.
So that would be provincial digital centers in English, more or less.
Centers, exactly.
Yeah.
And we found during the trainings that simple things like the concept of using a mouse, scroll up and down, browsers, even the leaders in many situations who are not really comfortable with these terminologies and with these expressions. And even with my work today, I still have to do trainings, and you have a whole spectrum of people. You have a room filled with I don't know, 30 employees, and about 70% go along perfectly. They can understand, but then you still have those 20% or so in the center of Mozambique, obviously, that are really at loss when you start throwing words like browsers, when you start throwing words like scroll up and down, and you find that you really have to make it as basic as possible and kind of teach the absolute basics to ensure that the training and the message is not lost on those participants. Obviously, the majority of the Mozambican population is under 18. I think half of our population is under 18, and their digital literacy is at a completely different level. There's a lot of hope
We are seeing the same sort of demographic shift that we are seeing, I guess, all over the world. It's happening also in Mozambique. You see a big difference between sort of the adult population and the youth, of course. Yeah. But thinking about this limited tech infrastructure or this low tech environment, what does that mean for the civic tech community in Mozambique? Or I guess perhaps even the first question is there a civic tech community in Mozambique? How big is it, and what is it made of?
That is a great question. Honestly, that's a great question. I think you're going to give me a hard time with all of your questions today, Afton. But I think we have two essential communities. We have social entrepreneurship and we have civil tech. Social entrepreneurship has managed to grow more easily than civic tech. We have things like a famous platform in Mozambique called Biscat that allows informal workers to find clients. We have, also used to have platforms where teachers can reach potential students. So there are efforts being made in social entrepreneurships in platforms that help people, even things like mAgri, financial inclusions. There's all of that going on. Civic tech is where I think we're lagging a bit, to the point that I'm even having a hard time coming up with examples of civic tech that are still operational. I was involved in a project called Nchuva, whose purpose was to allow the population to inform on waste collection issues, like if the garbage trucks didn't pass by, if it was being filled up, if the waste was overflowing, things like that. And for a short period of time, it looked like it was working fine, but then afterwards, it was working fine within the peri-urban area in Maputo, but then afterwards, it just seemed to disappear. I'm not sure why, but yeah, it seems to be a fairly common situation. So I think the civic tech community requires a little bit more support to really get off the ground in Mozambique.
Yeah, I mean, I want to come back to that a little bit later, exactly that issue of usage and absorption of technology, because Pensa has been quite successful in this regard, but perhaps we'll wait with that discussion. Is there any, I mean, you were mentioning specific initiatives. Is there any kind of network between people working in civic tech? Is there a community? Is there a platform where people share ideas and support each other? Or how is civic tech organized?
Unfortunately, again, that's probably one of the areas that we should be dedicating more resources into. Social entrepreneurship in general is getting some support. There are several incubators geared towards that, each one essentially working independently, I guess, but with the common goal of helping individuals and organizations, helping other people in solving the issues that are relevant to Mozambique. But with regards to civic tech, I don't think we have an infrastructure set up to facilitate the things, to facilitate the process and help make it more successful. And that's probably why we don't have as many civic tech examples as other places.
Okay, so there's no organized community.
No.
Yeah. What about collaboration with government?
It falls under the same umbrella. You're essentially left to your own devices to figure out how to get this to work, to figure out how to set up the agreements and how to set up the partnerships. And it's not an easy feat. Definitely, there's a lot of legwork involved in that. It's a huge learning process. I have seen what's the organization? FSD Moz, Financial Services Deepening. They've kind of tried to address this, but more in the financial inclusion sector. And they've interacted with the Bank of Mozambique to create a sandbox, essentially, which is free of a lot of the regulatory weight in order to test a couple of technologies. So definitely FSD Moz is probably an example of an organization that is helping to kind of bridge this gap and address this issue. But a lot of times, things specifically for civic tech, I have not really seen too much.
So is it correct to say that it's the collaboration that exists is built around specific initiatives and perhaps built around personal relationships, and thirdly, driven by a specific grant or specific contribution?
Exactly.
Yeah.
That's the situation. Definitely, more coordination is required, and essentially a proper guiding, principle that this is where we want to be in 5 years, and these are the steps that we will take as government and as civil society to help reach those goals. So that's definitely something that we need to work on.
Mm. I want to move on and talk a little bit about the health sector, and obviously I'm aware that you are not necessarily a specialist in public health, but you worked in the sector for a few years, not only in the context of Pensa, but also in the context of other projects. Again, we don't have time to go into the details, but very sort of overall, just to give our listeners an idea, how would you characterize the overall health situation in Mozambique?
Well, one of the things we have to bear in mind is that the health sector is one of the few that is present, at least in Mozambique, one of the few institutions, the Ministry of Health in particular, is one of the few institutions that's present not just at a provincial capital, but essentially at the district level. The logistics around that is mind-boggling. So because of that, sometimes it becomes a little bit hard to get sufficient collaboration, involvement, even of all of the sectors. And you can imagine for most initiatives, you require the involvement of several different directorates and the inputs of several different people. And sometimes that's quite difficult. And I think that's something specific to the Ministry of Health, given its dimension. You know, few of the ministries have that. Maybe the only other one is the Ministry of Education. So it's very challenging in the Ministry of Health for that reason.
Yeah. And I presume most people rely on public healthcare, although you do have private healthcare as well, right?
No, definitely is private healthcare, but again, it's more focused on the capital, Maputo, and on provincial capitals. As soon as you start moving a little bit away from there, the situation changes dramatically. It's also worth taking into consideration that the most important, well, again, it's probably inappropriate for me to say the most important, but the one that the health area that has the most reach is primary healthcare. So we're talking about the what you call health centers, I guess that's the right thing, health centers, not the hospitals, but the health centers. And those are primarily public. You know, those are the ones that the majority of Mozambicans would probably encounter when they have an issue. There's a big weight on the ministry to get that properly operational and deliver things with the desired quality. It's worth mentioning that we have another aspect that is now jumping into this picture that makes things a little bit more complicated, and it's decentralization. It's something that was agreed by the government before the last election. So even the last elections, we're already moving towards decentralization, and we're in that process. So all of a sudden, the Ministry of Health will have less direct control as to what happens at the health facilities at the provincial and the district level. So we need to figure out, how exactly this is going to work, what are the implications, how we can still guarantee sufficient quality despite having the management at the decentralized level. So there's a lot of complexity to this machine, unfortunately.
How, I mean, it's again another difficult question. I'm aware of that, but how far would the median Mozambican living in a rural area, how far would that person have to travel to get to access healthcare? You mentioned district level health centers, I believe. Is there a health center per district or multiple health centers per district? Do you have an idea of?
That's a great question. My answer is that information is on Pensa, so you'll have to access the platform.
Okay. Yeah. Okay.
No, we managed to get from the Ministry of Health, with actually the help of CBC, the list of health facilities nationwide. Again, I can't remember exactly if there's one in every district, but I think there is. There more or less is a correlation between district and health facilities. It's not the same thing for provincial hospitals. Obviously, for district hospitals and rural hospitals, that's a whole different thing. But in terms of health facilities, yes.
Yeah, but I think it's probably important to remind the listeners of how big Mozambique is, which means that even if there is a health center in each district, it still means that some people will have to travel 20, 30, 40, 50 kilometers perhaps to access healthcare.
Exactly. That's one of the reasons that things like community healthcare workers are gaining more relevance in Mozambique. And again, with it comes a whole question of collaboration, because one organization will fund community health workers in a particular province and district, another one in another one. So ensuring that one, they're fully trained and that they're coordinating their activities is, again, it's another level of complexity to all of this.
Yeah. Do you know what is the government's strategy sort of broadly for the health sector, and perhaps importantly in the context of our discussion today, does that include some kind of digital component? Is there a government vision for using technology and digital solutions in the health sector?
Well, I'll say yes and no. Yes and no. The government has something that they call the PES, Plano Econômico Social, it's the Economic and Social Plan, which is usually a 5-year thing. And these plans, it's not exclusive to the Ministry of Health, it applies to all of the sectors essentially, where they have 4 or 5 main pillars. And in these pillars, they kind of divided into projects and initiatives and so on. One of the big pillars for the Ministry of Health is essentially preventive healthcare. So keeping people informed, keeping people aware of the relevant issues so that they can prevent the contraction of diseases. So this is obviously highlighted over there, and education of the citizens is extremely important, but there's no specific mention of tech in that context. There is, however, a mention of tech for central management. Things like, I guess it's called DHIS2 or CISMA. It's the National Health Information System platform. And it's the one that's used at the Ministry of Health, and it houses the reports, essentially of everything, the mortality rates, the birth rates, it's used to emit things like, death certificates and so on. And it has the KPIs built in. So that has become a very important tool for the ministry, and they're kind of expanding on what it does now.
But if I understand correctly, that would be sort of the upstream collection of data or channeling information from the districts to the central level. It does not involve a downstream sort of outreach component, does it?
No. The main focus of that platform is to centralize and to collect all of that information, which in itself is already a big accomplishment, because one of the problems in the past was the silos of information that existed. So you had, every essential project or initiative would come in with a new platform, and they would just proliferate without communication, and it really didn't bring much value to the ministry. So one of the efforts now is to consolidate and integrate all of that to get a better picture as to what's going on. And this is that aspect is represented in the ministry's plans.
Okay. So you've already told us a little bit about yourself and how you ended up in this space, but can you tell us a little bit more about the idea behind Pensa? How did it spring?
It's actually very simple. It was during the I don't know what's the right word, scare throughout particularly Africa. And I remember being inundated with information over here. I was receiving it via emails, social media and so on. And for a work trip, I had to travel a little bit outside. And just in the conversations with the population in different places outside of the capital, I realized that there was absolutely no awareness of this issue whatsoever. And that kind of,
Sorry, because the connection broke there. You said what issue exactly?
Ebola.
Okay, thank you. Yeah, we missed that part. Yeah. Thank you.
Okay, perfect.
Essential part, yeah.
Yeah, very essential part. Yeah. As soon as I ventured a little bit outside of the capital, nobody really knew much about Ebola, and immediately this, kind of got me thinking, like, why is this information not reaching there, and what's a better way of doing this? Because obviously, were something like Ebola to reach Mozambique, at least that was the thinking back then, the more people are informed, the better that they can protect themselves, the better they can start applying the appropriate measures. And the first thing that we noticed, sat down and kind of did a little bit of brainstorming, was that, the technologies being used were not appropriate. And that's when we come back to essentially the topic of this webinar, using low tech to get the information out there. And we realized that, of course, the device that people most have at the disposal, whether it's directly theirs or shared, is a cell phone. So finding a way to get that information on cell phone. And again, the conventional knowledge was let's use an app, but the majority of people don't have a phone with the capability of downloading an app, be it a smartphone or a feature phone. Most of them have what's called a basic handset. And on top of that, then there comes the second question. What about the data networks? Does it reach there effectively? And even the cost of internet. So because of these reasons, we decided to build something around USSD that does not require internet, can be operated through the most basic phones. And given things like M-Pesa in Mozambique, it's a technology that's well understood. People might not understand the term USSD, but they use it frequently. Almost everybody that has a cell phone uses it. So yeah, we decided to deliver this information through USSD and SMS to the underprivileged.
And for people who are not familiar with the terminology, can you just briefly explain what USSD is?
It stands for Unstructured Supplementary Service Data. It is essentially an SMS type technology that it works through any handset, and it provides menus, provides an interactive menu. So for instance, whoever interacts with 150 hash, you dial a number, and then you receive a menu with a series of options, and you essentially just go through it. You select 1, 7, so on. You can even write text, which then gets sent to the backend system. And that's in a nutshell, that's how it works.
Yeah. So it's the technology that a lot of us probably know from buying airtime or data using a mobile phone. You enter something and you get simple menu options. Okay, good.
Yeah.
So coming back to Pensa, at what stage did you approach the Ministry of Health, and how did you approach the? I mean, I know from my engagement with certainly South African civic tech or people working in civic tech that one of the things they struggle with is that relationship with government, with ministries, etc. Did you have a fully developed proposal before you approached them, and did you engage them about the idea, and how did you find the right people?
Again, great questions. I got lucky.
Thank you. You're lucky.
I got lucky. That's the best way of putting it. I'd had the idea, and again, I guess, analysis paralysis. I just kept on trying to figure out what's the right way to go forward. And I started formulating a bunch of ideas, but in the end, it came down to things like financing. I didn't do anything with the idea for a while. Then I saw a proposal on the newspaper by the National Innovation Fund, FNI, which is part of the Ministry of Science and Technology, where they were providing, grants, non-equity based grants for different innovations and ideas. I submitted my proposal, they liked it, and that was a huge step forward. That was a huge validation of the idea in the first place. With that validation, with that award, I then started knocking on the door of the Ministry of Health. And initially it was, it's a little bit difficult getting to the right person. They kind of bounce you around different departments, different directorates. Eventually I still remember the meeting today. It was senior level ministry officials sitting down, grilling me on things that I knew nothing about really, but I was like, okay, I still think that this technology has the chance of making a difference. And they said, okay, well, if from our side all that's required is information, and you can handle the development and you can handle the agreements with the operators and all of that, then there's no reason for us not to move forward. And they gave the green light, and we started developing after that. I don't know if I should get into the details of the development now or wait.
Well, that's actually what I want to talk to you about. But just before that, I wanted to know, was it a formalized agreement? Did you have to sign an MOU with the ministry, or was it just an informal saying, yes, if you can develop it, we are willing to host it or provide information? How formal was this agreement?
Initially, it was just a verbal agreement with no timelines, no exclusivities, no responsibilities, nothing like that. I kind of pushed for that. So I started sending letters asking for a response from the ministry, kind of, I'm not going to say formalized, but just to have an element of, something on paper to show that, yeah, there is an agreement to move forward with source code. Initially, it was not in the form of an MOU. It was just a letter kind of acknowledging that, yes, we're working together or we're building this platform together. With that letter, I then approached the operators. So, okay, well, we're here, we're doing this. Here's the ministry's letter saying that, they're interested in going forward. What can we do to make this project a success? Because obviously we did not have money at that time. We received a small grant. I think it was $20,000 at the time for the entire launch, development, everything. So that we will not be able to pay for the actual SMS and USSD transaction, but also we can't charge the end user. That defeats the purpose. And we're fortunate enough to have the operators recognize the importance and the value of this, and they availed the SMS and USSD channels free of charge, both for the end user and for us, which made things much easier in terms of development and in terms of financing this entire idea. So like I said, I got lucky. We got lucky.
and I'm sure it was also hard work. Was it you? Did you have to approach the MNOs, the mobile network operators, or was that through the ministry? Were they able to
No,
help you there? That was through you. Okay.
No, it had to be us. And that's why one of the reasons that it had to be us is because if you approach a single operator and you have an idea or an initiative, they can embrace it under their platform, under their network, and kind of brand it as their own. And that was something that was an option that was actually put on the table for us. But the problem with that is that then you are restricting who can use this service. And we essentially wanted to be something like a public service. The idea was that anybody, anywhere can get health information. So we had to avoid that. But if you're going to do that, then you need things like a license from the regulator, which has its own set of obligations, its own set of costs. And again, it requires preparation, having the right team, and all these things. So the ministry obviously can't do that. The ministry can't have this license because the requirements, I think, are contradictory to the mission of the ministry. So we are the ones who acquire the license for the codes and so on, which then allowed us to interact with the operators, because the operators can't open channels like that if you don't have the license and you're not recognized in the eyes of the regulator. So yeah, we acted as the link essentially between the Ministry of Health and the operators for all of the integration.
No, I'm asking about it because I really find it's quite fascinating how much of, certainly in this case, how much of civic tech was not related to tech. It was a question of bringing people together, identifying the right people, securing the right agreements, securing the right endorsements to pull all these different components together. You had funding available, you had to get some kind of endorsement from the ministry, and you had to make an agreement with the mobile network operators. And all of this happened before you even started the development process. So tell us a little bit about that. How did that go? Did you do it yourself? Did you hire people?
No.
What was the development process like?
No, I hired people for that. I had people. Before that, a lot of the development I did myself, but over here, I kind of prepared. I acted as an architect. I designed how the solution should work. I had the high-level diagrams and so on, but then I hired some developers to work with me. It was hit and miss, I have to be honest. There were a couple of people I hired that kind of took me back a couple of steps. There were others that were much more helpful. But throughout all of it, it ended up being a learning process on the management of people and software. But yeah, we definitely had to, that's really where the majority of the financing went. Things like licenses and things like human resources for development, which is the other elements that they were essentially freelancers for that project at the beginning.
Yeah. And what about, because I mean, one thing is developing the platform, but an important part of it is all this health information that the ministry committed to providing you. What was the process for getting that information? Because I imagine it was not an easy exercise.
Knocking down doors.
Same way, knocking down doors.
Yeah, okay. Like same way. We, at some point, the lesson that, at least I think everybody will have a different experience. Everybody who's worked in civic tech will have a different experience. But one of the things that we learned fairly early onwards was that if you make things too open-ended, you won't get any sort of answers. People just, they get lost in a sea of options. So you have to be very, we formatted the menu. We kind of decided what should be where, how it should be structured, what are the sub-menus, and what kind of information will be available, what's available as USSD, what's as SMS. And we then presented this, and we even went online, we searched online, okay, what's the information for malaria, for preventive, and so on and so on. What's the information for HIV, and so on and so on. And we essentially prepared all of this. And then once there's something usable and real, it made it much easier for the Ministry of Health to look through it, review it, and give feedbacks. So that was the very first thing we learned, that we had to be much more proactive, and it made the process much faster. And then they came with this, the great advice. For instance, we can't just be infectious diseases. We have to include non-infectious disease. And then they provide a whole other list of things. And then they provide, health center information nationwide, nutrition, things like that. Then an avalanche of information came. And then when it came part to essentially filter that, again, a new stage of knocking on doors, tweaking, and then getting their approval. So there was a lot of legwork towards getting the content right and approved for the platform. Yeah.
But also a sign that the ministry was by then the ministry was taking ownership or saw the value of the platform. If they started proposing content, that means they saw the value of it already.
Well, they were engaged in the platform. I think they saw the value, yes. But at that stage, nobody really knew what to expect. Let me put it like that. So the project had been approved. We're working on this project, and we have to deliver because this is the project that's on our table. And the champion for the project at that point internally was what they call the Secretario Permanente. I'm not sure what's the direct translation for English.
In South Africa, it would be Director General.
Director General. Yeah. Okay, there you go.
Like a senior civil servant.
Yeah, exactly. Senior civil servant. So it was the Excellency Dr. Zacharias Ndonga, and kind of having that weight helped push things along. Where people knew that there's people who want to see something happening. Every once in a while, we'll have to go and present to the ministry how far it would progress every month or so. They want to know what we've done, what was still left to do, and so on. So it kind of helped things to move along. But also we had expectations, not just on our side, but also from the operators who were getting antsy. And they're like, we gave you the channel months ago, almost a year ago. What's happening? And at the same time, we had the donor, the financier, FNI, and said, okay, we gave you the first, disbursement. What's going on? When can we expect more? So we always felt that pressure to push for things to move faster.
Yeah. I want to talk a little bit more about, because as I mentioned initially, you have been quite successful in terms of reaching a large audience all over Mozambique. But before we talk about that, can you just quickly take us through the user experience of Penza? If suppose I am sitting in a remote district in Mozambique, and I want information about health, what do I do?
Well, you would go onto your phone. Okay, I guess I'll have to take this off airplane mode.
Oh, you were actually going to show us, or what?
Yeah. You would dial *660. I don't even know if you can see that properly. *660, probably.
Yeah, I can see it so far.
And then you just dial, and you are presented with a menu of options. From there, you just select. For instance, over here, I will go to mother and child. I will then go to vaccination calendar, option 3. It then asks me to submit the age of the child. I will put 3 months. And then I'm sent it says it will send me information shortly. Then I receive an SMS, which I don't even know if you can read that, but it's all in Portuguese.
I can see that you've seen something.
It says for 3-month-old baby, they should do a second dose of the following vaccines: oral polio, pentavalent, pneumonia, meningitis, rotavirus. So it's fairly simple menu-based structure. A lot of times you just put numbers in, and you go through the menu, and it gives you the result. Usually via SMS. Initially it was via USSD, but then we said that the response should come via SMS, so you have it stored on your phone.
So that makes sense. So I request the information via USSD, and once I've selected the information I want, I receive it as an SMS, and I can see that even when the USSD channel has closed.
Exactly.
And how? So I suppose one of the big challenges is to structure all this information logically, so it makes it easy for the user to understand and to navigate, because there's a lot of information here, and you need to make it easy for the user to navigate in all of these menu options. How did you develop that logic, that structure? Or is it trial and error?
A lot of times it's trial and error. I think one of the things that helped a lot is that we are a tech company. We're not really health specialists by any means. So for instance, if we didn't understand, we didn't even try to, we tried to understand obviously, but we didn't even try to submit information that we couldn't understand. Anything that we could understand, we immediately said, okay, this is too complex. And even if we could understand it, we would often say, how can we simplify the language? And that's actually that was and continues to be one of the most difficult parts of the interaction. The Ministry of Health, when you're dealing with doctors, the terms and the terminologies that they use, for them, it's just so normal that it becomes how they think. And it's a really long exercise to kind of dumb down the language so that everybody else can pick it up and everybody else can understand. Yeah, and it continues to be an issue until today, I have to say. It's trial and error. Yeah.
I know Mozambique only has one official language, which is Portuguese, but many more languages spoken throughout the country. Is the information available in only Portuguese or multiple languages?
It's only available in Portuguese. We are looking to extend either to other languages or to voice. So that's one of the next things that we're considering. And we've put up to proposal both with the ministry and with other organizations because we want to see what's the best way to get proper reach.
I know from other civic tech initiatives that one of the biggest challenges really is how you get people to use it. No matter how good your platform is, no matter how amazing your solution is, if people won't use it unless they have to be aware that it exists, and B, it has to make their life easier. There has to be a problem that that your application or your solution is solving. How did you launch Pensa, and what did you do to make people aware of it?
Okay. Oh well, the first question is an interesting story. After we had everything ready, we kept on insisting with the ministry for them to pilot and give it the green light. So it was available over there. *660 hashtag was just available over there, but only the people within the ministry essentially knew of its existence, and they were supposed to be playing around with it. The response was slow. The response was kind of slow. People didn't have time. It's completely understandable. There's so many projects going on. There's so many initiatives that it's really hard for you to get somebody who's very busy to take hours off to sit down and kind of say, should there be a comma here? Should there be a full stop there? But randomly one day, it seems like the existence of the platform started spreading through word of mouth. And I remember, I remember one day, out of nowhere, I woke up in the morning and I go to look at the reports, and we had 26,000 users the previous day from nothing. We hadn't done anything. 26,000 users, and it was on social media. I was getting messages from different people, including the ministry, almost, some were happy. Others were kind of understanding why we launched without their approval. And they called us in and we sit down and discuss it. But what happened? How is this being launched? Because so many messages on social media saying this is a great initiative. We're really happy. The ministry is working hard. And that's when we informed them we hadn't launched. It just spread by word of mouth. So the very next thing we did is probably something we should have done earlier. We whitelisted who could access. So we asked for all the people, the provincial directors, the senior level management, all those people that needed to test and give the green light. And everybody else who tried to enter would say, still under development. But at the same time, I think it was the first time we kind of got a measure of how useful the platform could be. And it helped, I think, push things along a little bit faster. When we saw the 26,000 from word of mouth, then the ministry I think they were like, okay, we really need to make this happen quickly. And I think a month and a half later, we launched on the 30th of November.
So this is November, now we're in 2000.
Yeah,
17, 18.
Wow, it's going to be 3 years in a week or two. Yeah, okay. It's going to be 3 years in a week or two. Wow.
And just to be clear, so the 20,000 or 21,000, whatever it was that like sessions or unique users? Do you understand it? Like whether it was
26,000 sessions. Yeah.
Sessions.
The users,
okay.
it was It was a little bit. It was like 11,000 users. It was 11,000
Okay,
users.
but still
Yeah,
a substantial
26,000
number of
sessions.
unique users, meaning unique
Yeah,
phone numbers at least.
yeah,
Yeah.
yeah. And then after launch, I
And
think we got 70,000 sessions.
yeah,
70,000.
over the following 3 years, almost 3 years now, has there been a sort of a steady, constant increase, or is it exponential, or do you see bumps around certain health emergency? I mean, of course, I'm thinking also about. I mean, my next question was about what has happened during COVID-19, but perhaps how has it increased the sort of reach?
Well,
can you track that over time?
More or less, there was initially there was a spike right at the beginning. There was interest in this new platform, so the numbers went up. Also, when we change the content, the usage tends to be higher. The more the content is changing, the more people are engaged, the more there's a reason to essentially see and call the menu.
Yeah.
But for the first until the end of last year, we were at around 500,000 users. So this year, there was a huge effort from the Ministry of Health to increase awareness on the health platforms that they have, not just Pensa, obviously, but their social media pages, their WhatsApp lines, their Alo Video call center, and so on, to respond to the need for health information regarding COVID. And in that process, we got, at some point, we were getting 300,000 new users per month at some point. And
new users per month?
Yeah, 300,000 new users per month.
Wow.
So that's, that's when now that's how we're now at 2.5 million.
And just to put that into perspective, what's the current population in Mozambique? Is what, 30 million people, more or less?
Yeah, 29 million, 30 million. Yeah. And to put
impressive.
To put it into different perspective, there is, again, according to the census, there's 7 million people in Mozambique with cell phones. According to some other data from the data report, there's 2.5 million social media users in Mozambique. So it kind of puts it on par with
the total number of social media users in Mozambique. That's amazing. Yeah. Because obviously you have a lot of people who cannot access social media because they don't have a smartphone and access to internet, but they would be able to access information here. Could you? So what's the status of Pensa right now? What's the current status, both within the ministry and what's the current funding situation, and what is your thinking? You did mention that you are looking at ways of adding more information. Adding more languages or adding voice messages.
Yeah. Well, within the ministry, it's this year in particular has cemented the importance of a platform like this in terms of reach. We work hand in hand. When the ministry requests certain information we put on, we do it immediately. They have access to all the reports. They have an access. Beside the USSD channel, there's a website where anybody can access called pensa.org.mz. But there's also an admin interface, particularly for the Ministry of Health, where they can see things like reports, answer questions, and so on. It's cemented essentially our partnership. We have to do the same thing with our MOU, because we do have an MOU that we signed with them December 2017. That's still active, but yeah, that's where we started with the ministry. As for the sustainability, for the longest time, things were very difficult. We were struggling because obviously maintaining something like this, it's server time, it's maintenance. Even if the content is static, the network, the links with the operators could go down. Tomorrow they're changing the SMS server, so it requires a whole new reconfiguration and integration. VPN channels are up and down, and so there's work that still needs to be done 24/7. And there was an intention to include it in the Ministry of Health's budget, but the budget saw unexpected cuts for external reasons 2 to 3 years ago, which kind of made things difficult. This year we've had more support. Specifically from the Johns Hopkins University. Also, the ministry is seeing the relevance and the importance. They are encouraging other partners to use the platform for different initiatives and different activities. So for instance, we're now talking with PSI about information regarding some of the services that they're providing and the like, so that we're in frequent conversations with other departments and other initiatives. And lastly, we've had the fortune of winning two challenges. We won the MIT, we were selected as one of the solvers for the MIT Solve challenge for health security and pandemics. So there were 7 selected out of 2,200 submissions for all the different areas. And we were also selected for the COVID Action Challenge as well. So these are things that they were just announced, I think, a month ago. So the support is still gearing up, but that support that goes beyond financial. The main support is really technical assistance towards making it sustainable in the long run. And again, I said initially the idea was this was going to be a public service, would make it available, and boom, off of our hands. But we're seeing that that approach probably was immature, and we have to look at it a different way.
So that means the ministry has not committed or allocated resources to maintaining the platform.
No, not as such. But our agreement with the ministry is essentially that the platform will always provide health information, the information that they need, free of charge to the users, to the citizens. So I think as long as we maintain that agreement, I think that's pretty much what the Ministry of Health wants out of all of this. And again, if they are doing their part in encouraging the other initiatives to also embrace PENSA and not to create duplication and things like that, and to kind of have things centralized in the 1 or 2 platforms that are already doing this. They're definitely doing their part on that end. So I think it ends up being an example of a good public-private partnership. Right,
but just to make sure I fully understand, so the financial sustainability of this requires that you are able to, or that source code PENSA is able to mobilize resources.
Yes.
For the time being. Okay.
Yeah, exactly. That's what we're studying, the best ways of doing that do not infringe on the principles of free of charge, available, but no, we can't introduce constraints for the user because that defeats the purpose. So that's where we're working with the support of MIT Solve and COVID Action.
So a couple of steps back, what are some of the lessons learned from PENSA? Are there anything you would have done differently looking back, based on what you've learned and what you've experienced? Are there anything you would have done differently, and therefore something that the civic tech community in Mozambique, in South Africa, and beyond can learn from your experience?
I wouldn't have done it. It's too much work.
You wouldn't have done it.
No, definitely. Starting out, I was naive about the amount of work that this is. Extremely naive about the reality of this situation. Again, like I said, when we started out, the idea was we'll build this and then they'll see it's useful and they'll just take it and they'll manage it and they'll take care of the cost and all that. But that's not how things work at all in the slightest. So, again, the last thing you're going to do is start something like this, have 2.5 million people using it, and actually you see, even from things like when there were the questions available, people submitted questions, you saw that they felt the level of anonymity, they felt the utility out of this. So I really think that from the get-go, kind of understanding the dimension of the work that you're encountering, it's important. And it goes back to the things you mentioned right at the beginning. The more support there is around this, I think the easier it is for people to understand and to get moving. Because throughout all of this, you have to understand better project management, team management, taxes, accounting, managing of operators, licenses. I mean, all of it, it's a crash course in a span of a year or two. So it's a lot of work, and I had not realized this. So again, had I realized, I'm not so sure I would have started, being in full honesty. But since then, for instance, I've gotten other people who, through the PENSA website, they send questions and emails. with similar ideas and initiatives, and they kind of ask for guidelines. How should we structure this? How should we do that? So I see a lot of interest in pursuing things along these lines, and definitely we should look into facilitating the path for others that have similar ideas.
And are these because I've received some questions here in the chat, and one of them was about collaboration, sort of Pan-African collaboration beyond boundaries. So that these requests, these approaches or emails you're getting, is that from within Mozambique or from outside? And within you haven't had any collaboration with I mean, you did mention some of the support you're getting from MIT and others. You haven't there's been no collaboration, nothing with similar initiatives in other countries in Africa?
No, not yet. Through Village Reach, which is a civil society or NGO registered in Mozambique, I think also in other countries. We did have exposure to other initiatives that are somewhat similar in other countries. We reached out, way back in 2016 to UNICEF to also kind of, I think 2016 and then 2018, UNICEF to also kind of get their feel for other things in other countries with a similar environment, looking for partnerships and ways to solidify the platform and the service. But again, all of it, everything requires follow-up, let me put it like that. So if you don't have the resources to do the follow-up, you probably won't get what you're hoping out of the interaction. So
Okay. Walter, we've run out of time. It's been a great pleasure having you here, and thanks so much for sharing your story and sharing your experiences working with Pensa. I really appreciate your time. Thank you so much.
No, thank you very much. Thank you very much. I guess the last thing there's one thing I forgot to mention before with one of the questions is that our idea now is to, beyond just different languages and voices, to go beyond information and help with things like services through the platform. So things that actually could be useful to citizens, like reservations at health facilities and clinics, and finding out what's available at pharmacies, things like that. That's what we're looking towards to kind of add a new dimension to what we're delivering right now.
Okay. Thanks again. It's really been fascinating to hear your stories, and I think it illustrates how small the tech component is of a successful civic tech initiative. I mean, you really told us about the financial issues, the coordination issues, the political issues, the governance, public policy coordination issues that all have an impact on the success or failure of this type of initiative. So thank you so much for that. I think this brings us to an end. So I want to just finally take the opportunity to thank once again the Konrad Adenauer Foundation, who have funded this webinar series. If I'm not mistaken, this was the last webinar in a series on African civic tech innovators meet. So I really want to thank the Konrad Adenauer Foundation for their support. So thank you so much, and I'll speak to you again sometime, hopefully.
All right. Thank you very much.
All right. Thank you.